कितना है? इतना है या इतना है? जो नापेगा वो जाने कि जहां धरती और आसमान मिलते हैं, नानकुर से दूर, अगर मगर शायद से दूर, वहां भी दोनों में फर्क बस इतना सा है। धरती और सातवें आसमान में फर्क बस इतना सा है। ये एक अंतर प्रेरणा है। ये हमारी, आपकी, हम सब की अंतर प्रेरणा है। एक कदम, एक छलांग, एक बाजी, एक गहरी सांस और एक ललकार खुली हवाओं में कि हाँ, मैं बना हूं उन फिजाओं के लिए, कि हाँ, मैं बना हूं उन ऊंचाइयों के लिए जो ऊंची तो बहुत हैं पर नामुमकिन भी नहीं, क्योंकि मुमकिन और नामुमकिन में बस इतना सा फर्क, धूप छांव में फर्क बस इतना सा। तो बस चलिए फ्रेंचाइज इंडिया के साथ ये फर्क मिटा देते हैं। फ्रेंचाइज इंडिया।
Good afternoon, friends. A very warm welcome to our Business Opportunity Over Chai. And this special edition Business Opportunity Over Chai is presented by Management Team of Franchise India, Mr. Gaurav Maria, Chairman at Franchise India Group, and Ms. Sonia Chaudhary, MD at Franchise India Brands Limited. This special edition Business Opportunity Over Chai will help you to understand the greatest business opportunities that we Franchise India specially brings to you. Today, we have invited a great brand come from the region of Bangalore, the Mind Research Foundation. The Mind Research Foundation has established itself as a leader in evidence-based behavioral health. The organization has also progressively made its mark in the global behavioral healthcare space by focusing on filling the gap between neuroscience, positive psychology, and healthcare, and unyielding dedication towards research, discovery, application, and advancement of clinical solutions for the prevention, diagnosis, and treatment of multitude of psychology and psychomatic ailments. To know more about this business opportunity, we have invited the team of the Mind Research Foundation, Mr. Ripu Damanji, the founder. But before inviting them over this stage, I would like to introduce our panelists, Ms. Maria Shilpa, Regional Business Head in Bangalore. She is expertise to helping us to know the right business, how to choose right business in your locality. She will be helping us. So now I would like to hand over the stage to Mr. Ripu Damanji. Over to you, sir.
Hi, good afternoon, everyone. First of all, thank you, Franchise India, for putting this together and helping us put our business model and our mission in front of investors who are willing to look into it. So we are an organization in the field of behavioral health, started in the year 2014. And since 2014, we have been working with thousands of patients, clients in having various kinds of psychological issues, starting from anxiety, depression, and other behavioral issues. Post-COVID, the word mental health and behavioral health has become more popular and more understandable by the common people. When COVID created a wave, everybody understood that it is not just sitting home and doing nothing, which will give them pleasure. So behavioral health came into the front line. And then we have now people coming in and asking us as to what is it that they're going through and what is it that they can do about it. So to take that mission forward, we started the business model of franchising, which is what we are exploring today, and would like to have all of you join us in understanding this business more. So to share more details on this, I would like Harshika, if she can play a video, and then we can dip into the presentation, which will help us understand more. Okay, so we start with the presentation, and the presentation will basically help us understand what is going on and how it will actually take shape when you take up a franchise of the Mind Research Foundation under the portfolio of or the brand of 𝐂𝐴𝐻 Health Spaces. So 𝐂𝐴𝐻 Health Spaces is not just a place where we are looking at resolving psychological issues. It's a complete safe space which involves a variety of experts and which helps the community in covering a variety of uh, issues, so which are not met right now, which we believe that there is a large gap in. And then once these spaces or these franchise locations are available to the common people, it will be a great help to the community as well. So as you saw in the video, we are having we have worked with a lot of people in different spectrum of disorders, and now we are expanding and connecting those disorders with preventive health, geriatric care, cancer, and other health issues. So we'll go down to the presentation now. So we were established in 2014, and we are an evidence-based healthcare service provider. So whatever we are doing in terms of psychological handling or psychological interventions, it's all evidence-based. By evidence-based, we basically mean that anything that has been proven to work scientifically. So there is enough research data on any kind of intervention that we are putting in here. So when we talk about research and evidence-based information or evidence-based data, we are looking at a lot of like research papers and a lot of published data that is on the healthcare database. So whatever we are doing here is totally driven by science. So we are running a center here in Indiranagar, and we have 10 plus franchise locations in various hospitals, which are operating under our brand and supporting clients there. We are also adding naturopathy and Ayurveda in our upcoming centers, where we would be helping people to use these techniques and these interventions to prevent or slow down or completely eliminate the use of allopathic drugs, which are more addictive, but then with technology and with latest research and AI coming in, we have a lot of innovation coming in Ayurveda and herbs as well. So all the data that is collected in the system and all the patient interventions information is kept on a very secure cloud, which is totally encrypted. All the patient information is kept anonymously with the help of an ID, which is double coded. So no patient or no client can be linked to the data directly or indirectly. And all that data is put into a system where it is analyzed and gives us a clear purview of what is going on in the system. So, which actually explains the research-driven vision of our organization. And we are totally IT enabled. So whenever a client comes into a center, there is no need at all for them to share their personal information. They can simply choose a code which is generated by them over WhatsApp, and that code can be used for making and booking appointments and making payments and keeping a record of whatever is happening with them. We have, with the recent developments of AI, a multiple variety of models are available, which is helping us do better analytics of our interventions and how people are handling them, what is going on in terms of their overall life. So AI is assisting us in our analysis and also helping our people or our therapists to understand the deeper links in their clients' thought processes. So when we talk about 𝐂𝐻 Health Spaces, we have been trusted by thousands of people since 2014, and we have a clear value chain wherein we have understood and we have help these people come out of their issues, which block them from operating on a day-to-day basis. And our design and our strategy is totally focused on the clients. So it's totally client-centric, and we make sure that people who are coming at our center or our locations get a clear understanding of that as well. So our marketing and our advertising is totally centralized. We have a variety of algorithms that run ads over Google, over social media and other platforms. And we have a network of schools and hospitals that share our vision and also refer clients to our locations. So when it comes to the market size of behavioral health is estimated at $3 billion, which is a very large figure to understand as of now. But we are looking at a population of like 150 crores. So 1.4 billion people is what we are looking at. And with growing awareness and with greater understanding that people have now that physiological health is directly related to psychological health, it has now become common for people to relate when they get a stomach ache because they are stressed out. It is understandable when people see other human beings or other friends or family getting into difficult health situations because of high stress levels. We have already seen young people getting into heart disease or cardiovascular issues because of their lifestyle or because of whatever they are going through in terms of their psychological states. So all this information is very understandable now, which was not the case when we started. When we started in 2014, very less number of individuals used to understand this. And most of the time, we were related to deeper issues like acute issues. But we do not handle acute or severe issues at all. Our job is the bottom of the pyramid, wherein we are looking at mild issues or before mild issues even happen. So we are looking at a preventive model. The bottom of the pyramid means when people go from no issue at all, like a good healthy lifestyle, to having mild issues, starting from maybe headache or just sleeplessness or something that is bothering them to do their day-to-day work, which may turn into a moderate issue. And then further on, it can go into a severe or an acute issue. So our job here with this business model is to prevent people from getting or changing their level of severity. So we are looking at a larger pool of people, and we prevent them from getting into stage 2 or stage 3 of psychological issues. So this includes a variety of people, and with changing dynamics in terms of mobile, internet, information availability, we have a pool of people who are involved in here. So we are looking at adolescents, we are looking at adults, we are looking at elderly. So the whole population matrix is divided into different disorders and different issues that all these age groups face. So I'll move on to the next slide. These numbers are just approximations that have been shared, but these numbers are much bigger in terms of when we talk about preventive health. So these numbers are mainly talking about when a detection or something has been identified. So, but when we talk about preventive health, these numbers are much bigger. So our franchising model is a very simple one. It's very investor friendly. It's a 4-4 model, franchise owned and franchise operated. And we are looking at a space of 1,000 square feet, which has a common entry, and like a single entry would be preferable, wherein there is a reception and 5 individual therapy rooms of 80 to 100 square feet each. And then we have a large therapy room, which is a group therapy room, which can accommodate 6 to 7 people in one go, around 180 to 200 square feet. And we have equipment that goes into the place, which includes VR. VR is virtual reality, augmented reality equipment, which is now coming up again with the help of Meta's investments. Meta is Facebook. Facebook's investment in using their technology to allow people to support themselves with the help of these tools, which is on a metaverse device, which they can put on their head and then use it in and get into a virtual reality situation to help themselves. So our therapists work with not just discussing individual issues, putting in psychological tools, but also use technological advancements like what I just discussed. And at the same time, we have an AI bot, which helps these individuals to get daily exercises, daily reminders to do their work and to do their exercise or intervention that the therapist has told. So all this put together comes in a 1,000 square feet area. So the equipments are small in size. They don't need a lot of space to put in. And mostly you're looking at 3 chairs or 4 chairs with a desk in a room where a couple can sit or where an individual can sit or a family can sit together and talk about issues that they're going through. And we have seen lately that there is a large increase in the number of couple issues that we have seen because of availability of information and because of people want to choose an alternative before they split. So that number or that category of population is immense and it's very large. And then there are now people or couples who want to work on their relationship before it gets too bad. So they want to do it beforehand. They want to take a preventive step to keep their relationships strong, not just with their spouse, but with their family as well. By family, I mean parents, and by family, I also mean their children, because all these relationships are becoming more complex day by day. And the complexity is not just happening because of the changing dynamics of the world, but it is also happening because of the amount of information that we are taking inside with the help of these mobile devices, which is now in the hands of every person that we see. So that information is actually creating a lot of, I would not say chaos, but it is creating a lot of like complicated situations in the head or the brain, which can be sorted out if individuals or when individuals take the right amount of breaks, they take the right amount of like breathing times, which helps them to keep it low. So all this happens in that 1,000 square feet area. And to put this all together, you're looking at a 14 to 15 lakh investment, which also includes our franchise fee. And more or less the expense of the investment is happening on putting in the interiors and getting in the glass fittings and putting the sofas, chairs, and a little bit of equipment that is required to get the place started. So when we talk about putting in these rooms, we have seen a few investors, a few locations where certain type of counseling or therapy rooms are already pre-made. Maybe an educational institution was running earlier, or some we can get places where some structure is already existing if we look a little deep. So if that happens, then the investment may go down, and if it is not available, if it's a bare space, then we are looking at a 14 to 15 lakh investment. So the royalty is charged at 10%, which is paid monthly, and the agreement period is 5 years. The break even that we are looking at is between 16 to 18 months. And although we will be having a lot of support coming in from our office in Bangalore to every location or to every center that is going to be participating in this franchising business. And we are looking at an approximate ROI over the 5 years at 500%. So putting this model all together, I would say that we have a very lucrative model which allows people to use their money or use their investment to support the community and at the same time build a business that is worth like makes financial sense. So, in an investment that is below 15 lakhs or an investment that allows you to create a brand or create an identity for yourself that you are supporting your community with a business like this. Because at any given time, when we grow up, as in when we get into our 50s or 60s, we want to do something for our community because it is the community that has given us and has made what we are. So this business that we're talking about today allows you to give back to the community that you have, that has made you, or help you identify or contribute back to the same community. So we go to the next slide, and this was at the franchise show in Delhi. I am not sure how many of you were there, and if we have people who are here and had a chance to visit us there, I think you know already about our business, and we have 3 franchise commitments that are in pipeline and coming up. We will see them roll down in the next couple of months in Delhi, Mumbai, and Hyderabad. And I believe that with those commitments, we would be having a stronger presence in these markets, and those people will help all of you become more motivated to do the same thing that we're talking about. Okay, so once the investment is done in the business and the setup is ready, let's understand how it goes forward. As in, what is it that is going to happen, and how it'll work, and what is the thing that is going to be doing there. So we have a very structured approach towards clients. So we are not just looking at like elderly. We are not just looking at a particular age group, but we are looking at all age groups, starting from children to the elderly. So when a center is set up, our first step is to introduce ourselves to the community that is around. So that community primarily includes schools, colleges, clinics, hospitals. These are the places where people come first when something is going on with themselves. And schools and colleges have teachers and principal who are responsible and have a reasonable bit of idea as to if something wrong is happening with the child. So I'll step by step include what happens in each of these locations. So hospitals and clinics are primarily sending patients to your franchise location for taking up their psychological issues. Most of the time, you will see that clinics will be referring patients or clients to you. Hospitals have a different operating business model. So generally what they would do is they would ask your psychologist to go down there and practice and share the revenue with your franchise. So that makes every hospital in your community psychology ready, or they have like a psychologist in their setup. So they don't need to put a full-time psychologist, but they can at any time give you a call and get your psychologist there if they're not willing to send the patient out to your location. So, because sometimes or many times what happens is that we have IPD patients. IPD is inpatient, people who are staying there for 4 or 5 days. They need therapy on a daily basis. So a therapist can go down to the nearby hospital, give the intervention and come back. So, and the charges for them are a little higher as compared to what we are doing at the center location, because the visiting charges and additional service charges would be applicable. So that market or that component of business is handled by the individual the standalone center franchise to support that particular hospital. So the clinic part of it comes in where we're looking at general physicians primarily, neuroscience or neurology specialists, and gynecology specialists, and other specializations which have a direct relationship with psychological health. So when a client or when an individual comes to a clinic with a stomach ache and the doctor can see that there is more acid buildup, maybe it is called GERD, gastrointestinal disorder. So that particular identifier helps the doctor to understand whether something wrong is going on in the client's life. And he can ask simple questions like, are you feeling stressed, or are you feeling that you're not able to handle your day-to-day life? So such things helps the clinic to refer patients or clients to you. Okay, the schools and colleges are more straight because we have scoring or results of individuals give us a clear demarcation as to where is that the interventions are required. So if there is a sudden dip in a score of a child, the teacher can simply refer that student to our therapist or our center, and the parents and the children can talk about it. And if there are students who are not able to get concentration or who are not able to handle the overall education load, can also be handled, because there might be some home issues or family issues or even issues at the school itself, which may include bullying or abuse or anything that may be disturbing the child. So our job is to support the whole community. So your center is going to be not just operating on your own in that vicinity, but it will be working continuously with all the other stakeholders of the communities: hospitals, schools, colleges, clinics, teachers, school counselors, principal, parents, tuition teachers. Everybody would be working directly with you in one way or the other, because you're a community support unit, and everything that is happening in your community can be handled or supported by your efforts. So, and we also do a lot of community awareness programs that helps us, especially the geriatric population. So in community centers, we organize, the franchise organizes like tea sessions wherein we have preventive health programs that can be promoted or discussed with the geriatric population, who comes on a regular basis. So it's an annual membership kind of a model, wherein like a 65-year-old retired person who doesn't have a full-time job can come on weekends or twice a week to discuss regular issues of life with other fellow people who are of the similar age group, having a similar situation, put in a group together and come and talk. That's it. And we are looking at these sessions during times when we have low traffic in the center. So low traffic days are generally Tuesdays, Thursdays, like first half. These 2 days are, sometimes Wednesdays also first half is light, but these 3 days is where you are looking at people who are not working and are of a certain age group, which can be handled for community activities at your center. Okay, so let's come to the partner profile. See, for us, the most important thing is your thought process. So why are you looking at taking up this franchise? Because we believe that if you have something that is driving you to take this franchise, it has to be something reasonably strong, and not just the business model. It's your inner desire, or it's your inner drive to take up something like this. It should be something strong enough to make you or motivate you or make you feel that I want to do this. I want to support my community. You might be a seasoned entrepreneur who has a reasonable financial backing, and you might just be a psychiatrist or a doctor who has an existing practice, because that practice has already made you connect with the community. And this kind of a business or this kind of a community place is definitely going to add value to your existing practice. So we have psychiatrists and herb specialists coming down to the center or the franchise location who would be handling special interventions where therapy alone doesn't. So any kind of support that happens to the nearby doctors can come from your location. But you need to have that drive, your inner desire that should say that I want to do this. Okay, so let's see how and why you should join this, because it's not just a brand that you're getting, but it's a whole area of services. Because we have developed this and practiced this, and I've been running this since 9 years. We know the business inside out. So when you join the franchise, you would be having a lot of advantages of taking this up. So starting with, we're an established brand, and we are able to help you increase your flow of patients with our already existing relationships. We have centralized advertising, client management software, and then we provide regular training, assessments, and management to all your psychologists that are going to be there at the center. And those psychologists would be on our payroll, and we would be making sure that they are fully trained and regularly updated with latest interventions. And this happens with the help of a centralized training calendar. So every therapist or every individual has to mandatorily attend 3 sessions or 4 sessions per week to remain up to date. And then there's a supervision session that allows each of the therapists to explain and discuss their cases on a weekly basis. So all that happens from a centralized office in Bangalore, and that support is part of the business model. And we have a centralized chat, which is based on WhatsApp. And then we have a centralized borderline number where people can call in. And then each lead is divided into different parts based on the location, time, the location of the individual, number, and the choice of franchise location. And all that is done on a platform. It's all tech driven. So no individual lead messages are sent. So every time your admin person opens a dashboard on their system, they will have what leads are there in the system that have come through our website, through WhatsApp, or through direct calls. And then the local advertised number, which is of your center, will also be there on all the platforms, wherein individuals can directly call and book an appointment. That number has to be manually input by your admin person, and so is the buckets, because that information is hard to track. So that has to be done by the franchise. Okay, so and then we've integrated with multiple insurance companies. So we are working on a business model where the insurance companies can give a cashless facility to their insurance holders, and they can come and just show the card and go forward with the therapy. Okay, so the future is bright, because as complications are increasing, we are also improving on support systems. So we have an integrated approach that will help us, and that is already helping us in handling complex issues. So I think we are running a little ahead of time. So Harshika, if you would want to take this forward from there, and then, or if you want me to explain this slide, I can do that.
Great. Thank you, Ripu Damanji, for this wonderful discussion about the brand Mind Research Foundation. Now, Shilpa, I would like to hand over the stage to you for the upcoming questions that our investor is raising in our Q&A box. So you can start taking up their questions so that we can resolve it.
Thank you, Harshika, for handing over this stage to me. And again, thank you all for having this wonderful session along with Mr. Ripu Daman. I'm sure the cause and the requirement is very well understood here. And what I would take away from here is that behavioral health is something which we need to ensure that we give into a society at our best. And like he rightly said, we are here for a social cause. So we are looking out for partners who want to be engaged with us. And we would look forward to take questions from you all beyond this. And I would be more than happy to help you all get into this partnership. I'm seeing a lot of questions flowing in from people, which I'm writing back to you all. Few questions that I would say this, these numbers are from India and global. I think Mr. Repudebin, we will have to give this answer to Mr. Praveen Devan. Initially that what we saw on the slide.
Yeah, so the numbers are for India only, yes. So the global numbers are much bigger. And the numbers that we showed are as per WHO's estimates.
Okay, he also asks a question, how many therapists will be needed and who hires these therapists? Very important, I suppose we need to answer this question, please.
So every therapist that works at franchise location will be appointed by us. We recruit the therapist, and the whole process of training and managing the therapist would be done by us. We would be charging 15% of the therapist's salary as a management fee, which would include the training, management, supervision, everything, recruitment of the therapist on a regular basis. So you only need to have the space ready and one admin person who can do the day-to-day stuff and book the appointments and handle queries and make sure that everything is in place.
Thank you, sir. And we have Mr. Shivaram Krishna Kumar, who's asking us a question. How can we talk maybe to a psychiatrist who's already having a clinic and his style of treatment of patients?
Sorry, how can we talk?
How can we take to maybe it's take or talk? He probably wants to ask, how do we onboard or bring into a partnership with a psychiatrist who's already practicing is what he meant.
Yeah. Okay. Yeah. So that's really important and it's a very important question because see, a psychiatrist is an individual who is already seeing patients with psychological issues, but then he doesn't have the capacity or the bandwidth to do therapy, right? So he knows that therapy is important. So he definitely will refer clients. Like we get clients from so many psychiatrists here around in London. There is an understanding that is to be created with the psychiatrist, and once that understanding is created, they definitely refer patients, because normally psychiatrists would not have a psychologist in their setup. And if they have a psychologist or if they have tried to put a psychologist, they know the complications of managing and running a psychology center. So they definitely refer, and the relationship is strong. It is a permanent relationship.
Okay, we have a question from Mr. Ranjan. He would want to know who can be a therapist and what is the background required?
Okay, so therapists you need to have a minimum of a master's degree in psychology. So preferably clinical psychology or counseling psychology. So we do not take forensic psychology, or we do not prefer applied psychology or organizational psychology, but we're looking at clinical and counseling psychology as the major specialization for master's students. And then the second is MPhil students who have done a course in clinical psychology or other psychology specialization, which is relevant to clinical or counseling. So this is the minimum that we take. Anything above that is good. So your PhD is good, but then PhDs generally we recruit at our location in Bangalore, because at the center it becomes unviable to handle PhD candidates because the research work is not as much. So we do that centrally. So the higher paid or the higher specialization people are recruited centrally at central location.
Okay. Thank you, Mr. Epidemian, for a very elaborated profile of our psychologist. We also have a very valid question coming in from Mr. 𝐂𝐨𝐬𝐬𝐬𝐻. He would want to know what would be our role in the whole franchise model as to psychologists would be recruited by your side. So what is our role in this whole franchise?
Yeah. Okay. See, this is very relevant and understandable. See, we are operating under the FOFO model. So the FOFO model primarily states that you would be handling the center, as in rent will be paid by you, electricity will be paid by you, your day-to-day management of the center of the people are to be done by you, your housekeeping, admin, the overall connection between the employees and you is something that you would be taking care of. Right? Only the psychologist part is taken care of by us. Right? We do centralized marketing and advertising as well. So that is also part of our bit. But then local promotion, making sure that the psychologists are going to local schools, hospitals, and clinics, and connecting with community welfare associations, resident welfare associations, and doing all that networking would be your call. So that stuff can be done once a week. If you spare a Sunday or a Saturday for your setup, a couple of hours is enough for you to interview. And if that admin person is already working with you in one way or the other, or if you have a relationship with that person, that is even better.
So we also have a question from Mr. Sunil Nalawad. What's the modus operandi to heal a psychological ill person when he comes to our clinic?
Okay, so let's understand the process, how and what happens when an individual comes to a center. So first of all, an individual there are two ways to get into a place like ours. One, you self-identify. Self-identification means that I'm feeling that there's something going on and I want to go to a place like where I can get support. Okay. Second is where a doctor refers. So a doctor would refer, then doctor, teacher, or a hospital would refer, and then you already know that you want to go to a place and then process. So when you are self-identified, which may be due to a marital issue going on, or maybe too much of noise happening at home, or maybe too much stress at work, or maybe something that is bothering you, maybe it's a grief situation, or maybe it is a situation where you have lost somebody or someone in a relationship. It could be anything, right? So when it is self-identified, the process is that we do an intake first. Intake is basically a 30 to 45-minute session wherein we understand what is going on with you. Okay. And we try to understand the broad issue. Right? We're not talking about specifics here. We understand the broad issue. And once you understand the broad issue, we create a goal plan based on those broad issues. So the goal plan will include a variety of things. That we'll do this in the next session, we'll do this, we'll cover up these issues, and we'll try to help you figure out as to how you're going to resolve them. So we do not recommend or we do not give judgments. So our job is to facilitate you to resolve your issues. We are facilitators of the situation. So next, what happens is that then you come for a next session, the therapy starts. We talk more specific things. We talk about exercises, tools, which are customized to you, basically, what you need to do when you get into a situation where you don't understand what I need to do. So if it's a stressful situation where you're remembering your old friend and then you're getting worried about him, then how do you handle that? Fight or a angry situation in your family, how do you resolve that? How do you keep your composure and not let those things affect you? So there are a variety of other things that we do along with this. And then again, it's a WhatsApp driven model where you can share and get exercises directly. But when it is a clinical situation where a doctor or a specialist refers, in that case, we consult the doctor back. That is the first starting point. So if a doctor is referred, we'll talk to the doctor. We'll understand what are the things that you want us to look at, and then we work backwards. Right? So both routes are different, but then almost the operation or the process that it goes through is the same.
Okay, we take a last question, Mr. Repadaman. So Mr. Kaushal Seth asks, I as a doctor running my hospital want to integrate in it my hospital. Will it be practical to make it a part, or I won't be able to devote much time on it?
Okay, see, if you have a hospital already, so depends on the number of beds. But if it is more than, say, it's bigger than a nursing home, so we're looking at more than 20 beds, then I would not recommend to put it inside your hospital, because then it becomes more clinical, and then we might end up losing clients who are not clinical. So it becomes difficult for a kid or for an individual who doesn't who's not coming for those issues to go into a hospital. So I would recommend we can open up a setup next to your hospital or near your hospital if it is more than 20 beds. But if it is less than 20 bed, like a nursing home kind of a setup, then we can we can dedicate a floor or make a part of the center as this setup. In that case, if you have 3 or 4 rooms that are available, we can just we can look at the location and we can see and ask the architect as to what is it that can be done in this location to facilitate the process. So both ways it's possible. It shouldn't be a problem.
Thank you, Mr. Repadaman. I think that was a very informative session from your end, and I'm sure most of the Q&As have been answered. Over to you, Arshika.
Thank you, Ripudamanji and Shilpa, for this one presentation discussion about the brand, Mind Research Foundation. Friends, for more details about the brand and to know more about this business opportunity, you can reach us on our hotline number 9717683838. You can also write us on feedback@franchiseindia.in. Tomorrow again, Franchise India bringing 3 different events that we are doing in our locals, like Pune, Mumbai, if you belongs to. So you can reach us on our hotline number for more information. Thank you everyone for joining today's webinar.